Hello, my name is Pam. I have experienced water birth as a consumer, doula, and student midwife. I really wanted a water birth when I was expecting my 5th baby, but wasn't actually successful until the birth of my 8th and last baby. It was not my shortest labor by a long shot, but it was by far the best. As a doula, I have mainly witnessed water labor, as most of my doula work to date has been in hospital, and as a student midwife, I've been present for many more water labors as well as water birth. Because in the United States, doctors seem fearful of water birth, and even many midwives working in hospital are not completely on board, I wanted to find and be able to acquaint you with the benefits, safety, concerns, and guidelines of water birth. Water. Who does not like water? Life without it isn't. Let me show you some pictures of water in various settings. Many people love the ocean, and the crashing, then receding waves can be likened to the waves of labor. Waterfalls, such as Burney Falls in Northern California, pictured here, are beautiful and powerful, much like a laboring person. This lake in Germany exhibits the quiet serenity from whence comes great power. Lastly is a frozen variety of water. This picture of Mount Shasta, a dormant volcano in Siskiyou County, California, was taken from the south in McLeod, where I grew up. I believe both the mountain and the snow represent the potential for great power in either a volcanic eruption or the overflowing of rivers and streams when the spring rains and/or thaws come. The benefits of water birth for the mother are many. From the laboring or birthing person's point of view, perhaps the two most important are the relaxation and pain relief as exhibited in this photo. Of this picture, Mama said, "Moments before birth, calmly enjoying some tea, no pain at all." Women laboring or birthing in water have reported lower pain ratings. Further, because women are able to experience physiological birth, they tend to have a stronger belief that they are able to give birth without the need of pain medications. This may be due to the fact that, according to Cunningham, one of whose resources was Michelle Odent, the neocortex is needed to be at rest in order for the primitive brain to be in control. Water is a way of reducing the power of the neocortex, enabling the primitive brain to become dominant. As you can see, there are many maternal benefits to birthing in water. Some of them, such as the idea that water birth is seen as empowering and the whole experience is positive and more satisfying, should be the norm regarding birth in general. Others, including fewer or less severe perineal laceration and related issues, as well as fewer hospitalizations for whatever reason, are surely desired outcomes when birthing in general and specifically at home. There are many benefits for the baby as well. At the very least, there is no benefit to being born into water as opposed to being born into air, and there are some definite advantages such as low risk of infection, injury, and lower death rates compared to air birth. There are, of course, some concerns. Interestingly, most of these concerns are from the perspective of the person giving birth, such as unsupportive or even hostile staff, which as a doula in hospital I have witnessed. This is often supported by the lack of studies done in the U.S. and general lack of knowledge, which together are another concern. The two most potentially disturbing are water aspiration, which we will discuss in the next slide, and cord avulsion, which according to Nutter et al. May just be due to lack of data. Note the last concern, which is of increased odds of genital tract trauma. This needs more study, clarification, definition, or some combination of the three, because if you remember, there is decreased damage to the perineum. Interestingly, water birth is perfectly safe for mothers with previous cesareans, especially those with a low transverse scar who experience spontaneous labor. For more information on this, you might be interested to read Is Water Birth a Safe and Realistic Option for Women Following a Previous Cesarean Section by Diane Garland, which is listed in the resource section. Remember that water aspiration was a concern? One study suggests little to no oral intake of pool water by neonates takes place, which would indicate that water aspiration is not really a concern. If you choose to have a water birth at home, chances are your midwife already knows everything she needs to and may have already given you the extra list of supplies, including a drinking water safe hose. In case she is relatively new to water birth, keep these guidelines in mind. In general, a new hose and connector, a disposable liner, and no heater or anything unnecessary in the pool. This helps to ensure that no unnecessary bacteria are introduced to the water. If you choose to attempt a water birth in hospital, you may need to remind your nurse, midwife, or doctor of these guidelines. Basically, all that is needed is a regular tub with a faucet high enough that the laboring person will not inadvertently hit her head on it, and a simple drain. There should be no pumping or recirculation of water, no method of heating the water other than draining and adding more hot, and nothing extra in the pool. Nothing extra includes movable shower heads because they have long flexible tubes which cannot be adequately cleaned and disinfected and are breeding grounds for bacteria. Lastly, remember that water birth is highly controversial in the United States, despite being an accepted practice in other high-resource nations. Good luck, and I wish you the best birth experience possible.